It's okay. It's okay. You're okay. Hi. Good afternoon. You're all right. Do you know where you are? You're in the hospital. You had walked into the ER a couple of days ago. You were very disoriented, very distraught. Your blood pressure was very high. I was one of the nurses on staff when you had come in. It's okay. You're safe here. You're okay. It's good to see you awake at least. My name's Yvette. Like I said, I was one of the nurses when you first came in, and you seemed very distressed when you arrived. That was 5 days ago. So, yeah, just a little over 5 days ago. It was in the evening. Do you remember your arrival? There's no pressure to remember. Just take a nice deep breath and try to sink into the bed here. Are you comfortable? Do you feel as if you're needing anything immediately? Yeah, I know. With all the tubes and everything, it doesn't feel like you can move around very much. I'm sorry. When you first came in, there were a couple of nurses that took an interest in you. Yeah. We had seen someone very close to us that had gone through. I'm just glad that you're here right now with us. It's good to see you awake. I traded shifts with a couple of the nurses to make sure that I could watch over you and any kind of care that you needed. I'm really glad that I'm the one that you're waking up to. I'm just on my daily rounds, circling through, making sure all of your vitals are normal, making sure all of your fluids and your IVs and everything are set for the next couple of hours. Can you tell me a little about yourself? Yeah, we hadn't had much opportunity when you first came in. It's good to meet you. Please feel free to continue. I'm just going to check some things and make sure that your medications and you're hydrated. And also, now that you're awake, I can do some tests to see, where we're at right now. Okay. Do you know what day it is? Approximately? What's the last event that you recall? And on a scale of 1 to 10, how do you feel stress? Do you feel like you're overburdened? I'm so sorry. We weren't entirely sure your circumstance when you had come in. You weren't able to communicate to us what your needs were, what your struggle was. But you found your way to us, so for that I'm happy. So, if this is Sunday, what's the last day that you remember? That's something. You seemed very high-strung when you had come in. Do you want to talk about that? Is there any event anything like that that might have been triggering that. It's okay if you don't want to think about it. Just know that if you choose to, this is a safe place to do so, okay? I'd like to take some of your vitals. It's mainly one of the main reasons why I'm here right now is I want to document your progress. Happy to write on your chart that you've become conscious and interacting. That being said, would it be okay for me to navigate around you? I can test to see if you're a little bit dehydrated, do some basic sensory testing, and take some notes. Okay. Thank you. Unfortunately, I'm not able to get you anything to drink right now. We have to run a swallow test to make sure that everything is, that you're able to swallow so that you don't have any complications with that. I do have, though, some glycerin swabs. It's not as good as a good cup of water, but it will definitely make the feeling of being parched quite a bit less. Of course. Yeah, the nurses and I, sometimes we hoard them and we give them to our favorite patients. No, not really. We give them to anybody who asks, but just open your mouth, and what I'm going to do is run this swab all around the lining of your mouth. Okay. Thank you. There's a little bit more in the packet here, so just give me a moment. The trick to this is if you just keep it in your mouth, you don't swallow right away, you just kind of let it sit there for a little while. Yeah, it'll make you feel a little bit less urgent for something to drink. I will include in your notes before I leave, though, that now that you're conscious, if you'd like, we can proceed with a swallow test and see whether or not you can accept solid food, liquids, things like that. All right. I'd like to just listen to your respiration, your heart rate, see whether or not we have any kind of congestion going on in your neck area. Is that okay? Thank you. Yeah, I'm sorry, it doesn't taste very good. Okay. Is it okay if I touch your chest area here? If anything at any point feels uncomfortable, let me know, okay? Excuse me. So I'm just going to start by listening to your respiration. Just breathe normally. Okay. Listen to the other side. I'm going to tap on your chest a little bit. Same on this side again, I'm sorry. I'm going to move the stethoscope around to your back here. Just reach around, turn you to your side a little bit. Turn it down a little further. Okay. And if you would, if you can take in a deep breath for me. The same on the other side here. Just tuck this in. Take a deep breath in. And again. Good job. Well, that's good. I'm not hearing that there's any fluid buildup or anything that's causing kind of a foggy sense in your lungs. That's always good. Is there any repositioning or a pillow that I can offer? Something that might help you feel more comfortable? Yeah, of course, sure. See if I can just adjust you a little bit here and help with your posture. Okay. Just kind of pulling the sheet flat. If I may, can I take a look at your skin? I just want to make sure that we're not developing any pressure soreness or anything like that. Okay. I'm just going to lean you a little bit to the side here. How's that? Okay. I'm going to run my hands along your back. Does any of this feel? Does any of this feel uncomfortable? Do you feel any kind of warm sensation, anything like that? No? That's good. Okay. And how about on your shoulder area right here? More towards the hip area. Okay. Let's check your other side here. Is it okay if I... Thank you. Up your side. And how about your leg right here? Do you feel any extra pressure, sensitivity right here? That's good. Your skin, it does look a little bit irritated, but one of the other requests, let me get you positioned there. How's that? One of the other requests that I can make would be for a nice bath. I know that at the moment we don't really have a whole lot of options, but I could come in and I could get some nice soapy water if you have any requests for a shampoo, something that you prefer that's familiar. Okay. We'll think on that for a moment, and I know that sometimes just a thorough cleaning can make the body and the mind feel so much better. Is there anything particular that you'd like? Think about it for a moment. You don't have to answer now. Okay. All right. So let's go ahead and take a look at some of your dilation. One of the first things that we check for with any kind of neurological complication is to see your ocular integrity. So, do you feel okay with that? This is going to involve a bright light, so I want you to just go ahead and look forward. Look out the window if you might there at the window frame. Alright, thank you. I know this might be uncomfortable, but I'm just going to look at your constriction. Okay, good job. And from the other side. Just look over my shoulder there, okay? Now, if I may, if you can look at this finger right here and just focus on that finger, okay? Same but on this side. Okay. How do your eyes feel? Congested and swollen? Okay. We'll see if we can find maybe an eye drop or something that would be able to help alleviate that. I'd like to palpate the area around your neck and your chest to see if there's any areas where we have swollen glands, if we have any skin abrasions, anything like that. Would that be okay? Would require me to get a little bit close to you. Okay, thank you. Okay. So I'm going to start on the underside of your jaw. Okay. Just try to relax if you can. Just going to very slowly palpate the area, applying various levels of pressure here. Right around your trachea, I'm going to shift side to side. Does that feel okay so far? Please let me know if there's any point where you feel very uncomfortable or anything like that, okay? Thank you. I'm so glad that I got to be the one to see you when you woke up. You're okay. You'll be okay. We got you here. You're not, honey, you're not a burden, please. You're not a burden to us, not here. You're not a burden. There's people all around you that have been working around the clock to make sure that you're okay. I know it takes some time, but please, if you have the time to focus on just acknowledging that that's not how we feel. That's not how anybody feels, okay? You're welcome here. Yeah. You're okay. You're okay. I'm so sorry that it's so difficult, though. Yeah, stress can be so overwhelming. What do you think on this? Think about something that you like. Tomorrow, I'll have an opportunity on my next shift to bring in anything that would be familiar, enjoyable to you. Is there a shampoo? Is there a certain aroma? Is there something in particular that you would like? Unfortunately, I won't be able to bring you anything to eat because we have to run the swallow test first. But if there's something that you typically enjoy that would be pampering, a good facial product, a smell of a certain shampoo or anything like that. Yeah. Maybe I'll get some of the other nurses on it. Okay. All right, I'm going to continue with the gland check. So let's move. Yeah, just focus on that for a while. Okay. Let's go check your chest area here. Okay. I'm going to reach around to the back of your neck. I know that when you were first admitted, they had done a scalp check to see if there was any kind of adhesions or anything on your head. And we didn't find anything, but we might not have known your perception of that. So if I may, can I just touch around your head here and please tell me if there's any area that's particularly uncomfortable uncomfortable, sore, bumps, bruises, adhesions? Okay. All right, thank you. Yeah, I'm just checking the skin. Try the back of your scalp here. Any areas of tenderness that you feel behind your ears? That does feel a little bit tender. Take a look inside your ears, okay? I'm going to use that same light that I used for your eyes. Get real close. Just pull out your hair a little bit here. Okay. I do see that there is some debris built up and some swelling here. Let's check your other ear. Not quite as concentrated on this side, but you do indeed have some debris. Okay. I'm going to reposition here just so I can tilt your neck to one side. See if there's any swelling along the jaw. Okay, when your neck is extended here. Is that tender? I'm sorry. Okay. How about right here on this side? Okay. Well, why don't we, towards the end of the exam, we'll spend some time clearing out that debris and getting that area cleared out, cleaned, and hopefully relieve some of that pressure, okay? So let me wrap up on this end. I'm going to finish with eye tests, and then we'll get to that, okay? Of course, yeah. You're fine. You're okay. You're okay. You're okay. There's nothing you need to apologize, okay? We'll start with some reflex testing. So, I'm going to start with your shoulder on your right side, okay? That's good. Your elbow. And on the front. This is sometimes uncomfortable. Okay. Your left side. The back side of your elbow. And the front side. Okay. Just going to press on your fingers here a little bit. Is that okay? As I pinch your fingertips, I'm seeing that the blood restoration into the fingertip is what I would expect, so that's good. I'm going to squeeze my two fingers. Squeeze as hard as you can. gonna hurt me, I promise. Good job. Does your sensory seem to be as you are familiar with? Okay. I'm going to take a tuning fork here and just to see when the sense of a subtle vibration tends to become non-perceptible, perceivable. Okay. So, you'll hear this and you'll feel this. And when I touch it to your skin, I'll stop it. Okay. You tell me when you feel that sensation stop, okay? Thanks. Okay, good job. Your perception does seem to be on par, so that's good. I'm going to feel your belly a little bit more. Okay. Just checking for any kind of limitation in your digestion. A deeper depression here in the center. Is that okay? How about here? Okay. A bit lower down here. Continuing on with some of the other concerns regarding your hydration. With your permission, I'm just going to pinch various areas of your skin, pull them outward, and see how long it takes for that skin to settle back. Okay, so I'll start with your face, just on your cheek here. Chest area near your clavicle. I'm going to move your gown here to the side just so I can see a little bit more. Well, we can increase your hydration levels a little bit here through the IV, and hopefully we can get you on some more intake that you can take from water or juice or a beverage of your preference. But we're going to want to do a swallow test before we can be confident in your ability to make sure you don't asphyxiate. Is there anything that I can do right now that might make you feel a bit more comfortable? No. When some patients are unable to take care of themselves for a couple of days, sometimes a good, nice face cleansing, brushing your hair, making you feel a little bit more organized. I know that little efforts like that can sometimes be really important. We have some large cloths that are meant for, bathing. We also have, I have a hairbrush that we can comb your hair and, make you feel a little bit more normal. let me go ahead and grab that. Before we get started, given the debris that you have going on in your ear, do you want to see if we can get a treatment started so let that permeate the earwax? That's a great idea. Okay. So I'm going to take a basic saline solution. It's a spray, a topical spray, and spray it inside the ear. This will help any of the waxy material break down a little bit, and then we'll use a couple of different tools to pull that material out, dry it, make sure it's nice and clean. Okay, alright, just give me a second here. And is it okay if I get close and I touch your ear a little bit? Okay. So I know that this side was one of your concerns. We'll start on this side. Yeah, this one's not quite as bad. Okay, so just going to shield your face a little bit. The same on this side. Take a cotton swab just to see if I can get that to go a little bit further. Do you mind if I tilt your head just a little bit here? Yeah, this is the side we're more concerned about, so we're gonna. There we go. Are you okay? Okay. Just making sure that sinks into the ear a little bit more, as much as possible. The other side's not quite as bad. I'm going to take a clean cleansing cloth and just to go around the edge, like the top rim here, see if we can get any of the external cleared up. It does feel kind of good, doesn't it? Put a little bit of pressure on the center here, see if I feel a little bit of pressure build up. I'm going to even you up here. Just cleaning around the rim of the ear. Gonna let that settle for a little bit. How are you feeling? Let's use a little bit of soap, a little bit of additional cleanser. This evaporates very quickly, but it'll make your skin feel really nice. Okay. Do you have a skin product that you are fond of? Just lift your chin a little bit. I'm going to start on the underside. I've heard of that. I've never actually used it or smelled it, but I could definitely bring that in and we could kind of have a day of just trying to get back to familiar comfort. Absolutely, it'd be my pleasure. Can you look up for me? And do you have any other grooming concerns, shaving, tweezers, anything like that? I might be able to get you. Lift up your head a little bit here. I'm going to get your neck. Yeah, we could probably arrange that. Feels a little bit fresher. No doubt. Okay. Do you mind if I comb your hair a little bit? Just going to start at the end so that I don't pull on it too much. Around to the back a little bit. Other side. Back home. Okay. Oh, so much smoother. Isn't that nice? Is it feeling a little bit better? Let's take a look at that ear here, especially on your left side. Okay, the flexibility does appear to be a little bit more. On your right. Yeah. There's a tool that I frequently use, so that is an illuminated ear pick. And I'd like to start with that. It allows me to look deep into the ear, as well as a small spoon at the end. Pull that material out. I'll start with your right side, or I'm sorry, your left side, my right. And then if there's any extreme discomfort, let me know. We'll pause, we'll stop altogether if we need to, okay? And to start this, I'm going to pull up on your ear. Kind of stretch a little bit here, and you'll feel a little bit of scraping. Sorry. You okay? Okay. We're going to ease up on that side just a little bit here, and I'm going to move on to your right. And you'll let that calm down, and then we'll come back to it, okay? Thank you. Same on this side. Just pull on the ear a little bit upward. The nice thing is that this side doesn't appear to be quite as congested, so that's always good. I'm going to come back to this ear and just take a little bit better look. Take a cotton swab and just pull out the remaining material a little bit around the edges. Let's go ahead and do the same on the other side. How does that feel? You can hear better. That's always good. Okay. How does that feel? Oh, honey. Okay. You're safe here. It's okay. There's no judgment. There's no... We don't feel that way here. We're just glad that we can take care of you. I have to complete my rounds, but your call button's going to be on your side here. Please ring it if you need anything. Myself or any of my colleagues will be able to come in and hopefully make you feel a little bit more comfortable. I'm going to put in the notes so that we can hopefully arrange for a swallow test. And then hopefully we can get you set up on some solid and some liquid foods. Yeah. And then if there is any requests that you would like, I'll get that product that you mentioned. Yeah. At least make you more comfortable while you're here, okay? Let me reposition. I see that you're leaning to one side here, so is there any position you'd be more comfortable in? Okay. Go ahead and adjust your hair. How does that feel? A little bit better on the neck. Excuse me. Good. You want another glycerin swab? No, I get it. I do. Okay. Okay, thank you. Just go with the inside of your mouth here. It makes the thirst a little bit less. Yeah, I wish it wasn't this. But once we get you that test, hopefully we'll be able to get the next step. Get you much, much more comfortable, okay? I'm going to modify your IV so that you'll get a little bit more hydration, make you feel a little bit better on the inside too. You're safe here, sweetie. Yeah. Ring the bell if you need anything. I'll be in a little while just to check in on you, okay? It's been my pleasure.